My name's Juliette Cosgrove, for anybody who can hear me. I'm the Chief Nurse and the Director of Clinical Governance at an organisation called NHS Professionals. What I really wanted to talk to you about today is what NHS Professionals is. And also I was, for the last 3 months, have been the Chief Nurse at the Nightingale North West, which is one of the field hospitals that's been set up in Manchester. I thought I'd just tell you a little bit about how we used flexible workers to staff that for the 3 months that it was open. So NHS Professionals is an organisation that's wholly owned by the NHS, and it provides flexible workers to the NHS. It's similar to a bank that you might find in a hospital or an agency, if you've not heard of us before. We started off really supplying nurses predominantly and support workers into the NHS, but we've expanded our business now to deal with a little bit more broadly. So still the vast majority of staff that we supply are nurses and support workers, also midwives, therapists and healthcare scientists. We've got a developing arm of the organisation called Doctors Direct, which is supplying flexible doctors into the NHS. We've got a small and non-clinical arm where we've got admin and clerical staff and estates and facility staff. And we're also now trying to work across organisations, bringing organisations together so where they can provide the banks collaboratively. So that helps increase the access to the flexible workers. They've got more organisations that they can work it in, and it also helps manage the terms and conditions within there as well. So that's what we do. Tell you a little bit about, I've tried to get the most up-to-date data from the organisation. What I'm going to talk about is 1819, and I'll expand a little bit on what I know. Because we're not for profit, we reinvest all of our surplus revenue back into the NHS, and for 1819 that was just short of £7 million. We provided 26 million bank hours to our partners in 1819, which is 10% up on the previous year. Some of that's been driven by us becoming larger, us having more staff on our books, but also been driven by increasing vacancies within our organisations. One of the things that we do with our organisations is help reduce reliance upon agency. So we managed to support the organisations that we work with to reduce their agency spend by about £50 million. Think about the things that were important to our flexible workers, and one of the reasons people like to work flexibly, either as a sole career, but as also to support financially support themselves, is we've got a 5-day pay, so you can get paid within 5 days of doing your shift. We also, for our staff who just work only on with NHSP and don't work in other organisations, we've got paid holiday pay. So in 1819 we had just over 40,000 flexible workers join the bank across all of the staff groups, and in terms of nursing fill rates within the organisations that we work, 76% of the fill rate was through the bank. We're now working with just short of about 70 trusts, so that's quite a significant amount of NHS organisations. So what I wanted to talk about really was why you might choose to work as a flexible worker. Obviously, there's a flexibility, so we can offer you a wide range of shifts, and because the shifts come out to us from the organisations before they go to agencies, we're the first port of call. So if you joined us, you would have access to the shifts that come out as the widest range of shifts. I'm thinking of the time, so what I'm going to just talk about is what we did at the Nightingale. So in March, we were asked to set the Nightingale up, and one of the things we were asked to do was staff it as far as possible with flexible workers. That was a bit of a challenge to us. So I'm going to give a few examples of the staff that came on and how they developed their skills by being flexible workers. And I could see that quite a few of you were either thinking about becoming a medical student or a medical student. So we had a couple of medical students working with us. What we did was offer them short-term contracts. They worked with us for a month. And what they then fed back to us was what they had learned. They supported themselves financially, which is really important to them. But what they learned was how to work in teams, how to work in areas where there's a little bit of uncertainty about what was happening. So learned skills like being able to speak up when they didn't understand, recognise the roles of all of the people providing healthcare, which they felt was really important. They had insight into roles that they wouldn't have had that had they not chosen to work. They were working as support workers. We had some people who were training to be dentists working with us, and dental hygienist trainees as well. They found it more difficult actually to be involved in direct clinical care. And so we asked them, because they have great communication skills, to work to be family liaison. So they were the staff who spent a lot of time with the patients, obviously because the patients couldn't have visitors, and working with the families. So trying to use the skills that people had and further enhance them. The feedback that we got from everyone working at the Nightingale, and I've got some really nice slides which I can't show you, were that the staff found it tiring. So I think it's particularly when you go in, when you're going into healthcare organisations, when it's really busy, like it was with us, it's tiring. They all found it a rewarding experience. They found that it increased their confidence and their belief in themselves because they'd put themselves into difficult positions. They felt empowered, and they felt that they could work beyond their roles. So what I would advocate to you to consider is thinking about using the opportunities to join somewhere like NHS Professionals or any other bank or agency really, but to think about how you might then choose where you work, make sure you get the right induction and training as you go into that area, and think about how it's going to develop your skills, confidence, experience and ability in yourself as you go through your career, whichever path you're choosing. It's not something I started my nurse training in 1985. It's not something that was available to us in the same way then, but with high levels of vacancies, there are more opportunities. But I also think this pandemic has made a lot of people rethink about how they want to work. So by saying people who are now choosing to take a period of time, maybe 6 months or a year or even longer, out of what they're currently doing, think about going into different areas, working in short bursts. We've found that quite a lot of people like to work intensely for a month and then take some time off. So I think there are ways of preserving yourself, there are ways of developing yourself, and there are ways of contributing in a broader way than that career opportunity, career choice you thought you were going to take. I did have a really nice little video to share with you, but I don't think we're going to be able to do that. So I think because of time, I'll leave it at that. And I just wondered if there were any questions.
I haven't got any questions in the chat at the moment.
I don't know, David, you're a medical student, are you?
Yeah, I am.
Yeah, I am.
Have you ever considered doing flexible work, or do you do that?
I actually tried so hard to find somewhere to do that. But I think in Nottingham, so that's where I study, they prioritised work for the fourth year. And they didn't really need anyone else.
Yeah.
So it varies massively by the region. But I was absolutely dying to do something.
Right.
And in the end, I didn't end up doing anything. But I got a job in the co-op instead.
Yeah, you've got a lot of echo on your mic, David. That's it's a shame actually that probably the amount of there wasn't as much work as people thought there were going to be. But I think that's good. I think the thing is to keep committed to the idea of using it as a way of developing extra skills. And I think what we're trying to say with NHS Professionals is we're trying to really create a wide range of opportunities for people to like you did when you think you. I think some of it with the pandemic was about people stepping forward, wasn't it, and trying to help. But like I said, the feedback that we're seeing is it's really enhanced people's skills and confidence, which is another good reason to do that. And I think particularly we found from the dental students and the medical students, them understanding the real value of teamwork, communication skills, and understanding how things work from a different perspective.
Yeah, I agree. I think particularly for me as a pre-clinical medical student, that experience is all about the communication, the teamwork side of things, the ability to be able to talk to people, which is just as important as the clinical side of things as well.
Yeah. So I guess I've kind of come to, I think this has probably been, for anybody who can hear, I think well done for sticking with us. I hope that you will think about, at any point in your career, choosing to do something different and using NHS Professionals or other organisations to facilitate that. I think the other thing is we will... I worked in one of my bosses was a chief nurse at Southport and Ormskirk Hospital, and a lot of our medical workforce were people who were working flexibly, and quite a lot of people are choosing to slow down at times within their careers for different reasons, like family reasons, or family reasons, then and then picking that up again. So it's an option that people should really think about when they find things a little bit difficult.